Welcome back to the lecture series on periodontics. In this video, we are discussing about gingiva. Now let us start with a basic question. What do you mean by periodontium? Periodontium is referring to the supporting structures of the teeth. So periodontium has four principal components: gingiva, periodontal ligament, cementum, and the alveolar bone. So these components are working together to support the teeth and keep them functional. So without this support, tooth will not be able to withstand the forces of chewing or any other stresses in the oral cavity. Now let's move on to the concept of periodontal phenotype. To understand this, we first need to know what is a phenotype. The word phenotype refers to appearance and behavior of the tissue. So what is a periodontal phenotype? It is a combination of gingival phenotype and bone morphotype. Gingival phenotype refers to the three-dimensional gingival volume and the width of keratinized tissue. Bone morphotype refers to the underlying bone structure. So periodontal phenotype is a term introduced in 2017 classification system. So let us see what are the types of periodontal phenotype. So this periodontal phenotype is classified into three types: thin scalloped. So here the gingiva is thin and it is scalloped. Second is thick scalloped. Thick and scalloped. So in thick scalloped, gingiva is thick and gingiva is showing the scalloping. And third is thick flat. Here gingiva is thick but scalloping is minimal. It is flat. Next, let us understand the difference between a biotype and a phenotype. So biotype is referring to the fixed genetic characteristics, whereas phenotype on the other hand, it can change over the time. It is not fixed. It can change over the time. So this change can be because of environmental factors or because of some modification therapies. So periodontal phenotype plays an important role in the disease progression, and it also impacts the bone resorption. Next, let us briefly discuss the zones of oral mucosa. Oral mucosa is divided into three zones: masticatory mucosa, lining mucosa, and specialized mucosa. Masticatory mucosa is involving the gingiva and hard palate, whereas lining mucosa is covering the areas like cheeks, lips, alveolar mucosa, and floor of the mouth. So masticatory mucosa is keratinized, lining mucosa is non-keratinized, and it is more flexible. Third one is the specialized mucosa, which is usually found on the dorsum of the tongue. Gingiva is a part of the masticatory mucosa. Next, let us understand about the anatomy of the gingiva. Next, let us discuss about the anatomy of the gingiva. So gingiva is divided into three components: marginal gingiva, attached gingiva, and interdental gingiva. So let us take a closer look at each of these. First, let us start with the marginal gingiva. So marginal gingiva is also known as free gingiva. This is the marginal gingiva, which is also known as free gingiva. And this marginal gingiva is forming a collar around the teeth. So it is separated from the attached gingiva by a shallow depression, which is known as free gingival groove. So this is the marginal gingiva and it is separated from the attached gingiva by a shallow depression. So this is the marginal gingiva and this portion is the attached gingiva. So marginal gingiva is separated from attached gingiva by a shallow depression which is called as free gingival groove. So now let us talk about the width of marginal gingiva. Marginal gingiva is approximately 1 mm thickness or 1 mm wide. So here the term wide means it is talking about the horizontal dimension or the thickness of marginal gingiva. So marginal gingiva is 1 mm wide. It is forming the soft tissue wall of the gingival sulcus. So this is a gingival sulcus. So marginal gingiva is forming the soft tissue wall of the gingival sulcus. So this portion of the marginal gingiva is forming the soft tissue wall of the gingival sulcus. The most apical part of the marginal gingiva is known as the gingival zenith. So marginal gingiva, apical most portion of the marginal gingiva is known as gingival zenith. Gingival zenith need not to be in the center of the tooth. It can be anywhere. Let us understand the measurements of gingival zenith. Gingival zenith can be measured in two ways. Apicocoronal measurements, that is vertical dimension, and mesiodistal dimension. Apicocoronal dimension measures the vertical position of the gingival zenith relative to the gingival margin. So this is the gingival zenith and this is the gingival margin. So to measure this, you have to imagine a vertical line passing through the tooth long axis and note the gingival zenith position. So by drawing a vertical line passing through the long axis of the tooth, so the center of the gingival margin is located. So from this center, you have to note the gingival zenith position. So whether the gingival zenith is above this line or below this line. Next is mesiodistal dimension. So mesiodistal dimension measures the horizontal position of the gingival zenith. Now it tells whether the gingival zenith is closer to mesial, distal or center of the teeth. So here the center of the teeth is taken as the reference. So from the center of the teeth, where is the location of the gingival zenith in the horizontal position? So is it mesial or is it distal or it is at the center of the teeth? So this is how mesiodistal dimension of the gingival zenith is measured. The dimensions of gingival zenith can range between 0.06 mm and 0.96 mm vertically and horizontally. Now let's move to the gingival sulcus. Gingival sulcus is a V-shaped crevice or a space around the tooth. So this is the gingival sulcus, which is having V shape. Now let us see the boundaries of gingival sulcus. Gingival sulcus is bounded by the tooth surface on one side and the soft tissue wall of the marginal gingiva on the other side. The sulcus depth is varying depending on the conditions. So in a germ-free environment, the depth of the sulcus is 0 mm. Whereas in clinically healthy humans, if you take the histological depth, it is 1.8 mm. Probing depth of the gingival sulcus is 2 to 3 mm. Periodontal probe is used to measure this depth. Periodontal probe is used to measure this depth. Now let us connect this to the periodontal phenotype. If a periodontal probe is visible after you insert through the gingiva, if this is the case, then gingiva is classified as thin. If the periodontal probe is not visible after insertion into the gingival sulcus, then gingiva is classified as thick. So this visibility technique helps us determine gingival thickness, which is important clinical parameter. If you found this video helpful, hit the bell icon below and subscribe to my channel and stay tuned to Tooth Fairy Tales for more dental videos.